Hello everyone, this is Saili Tindorkar, clinical dietitian and nutritionist. We are live today from Shwas for You Clinic, and we are going to, as we have started the series of women's health, we are going to talk about uh, women's health. And as I have introduced this topic earlier, that women goes through different kind of stages of, there are different stages of life, and women go through different, the requirement of nutrition is different in all the stages. So what all are the stages? Your adolescent, adulthood, pregnancy, menopause. These are the major stages where our nutrition requirement differs. So, where we need to focus during these kind of stages? Very first, you should know that balanced diet is must to have in your daily routine. So, what all what all are the ingredient you should be consuming? How you should be consuming? All those things we are going to talk today. So, in balanced diet, very first, our major macronutrient, what we call, our diet is more based on those macronutrients. So, what all are those? Carbohydrate, proteins, fats, these are the macronutrients. Vitamins and minerals, these are the micronutrients. And our diet is more of a carbohydrate based diet. Our requirement of carbohydrate is between 55 to 60% in our daily routine, in our daily diet. And now the requirement differs as per the lifestyle of the person. Secondly, the age of the person, and other than that, if they have some other conditions like obesity, hormonal imbalance, then the ingredient, the source of carbohydrate also matters a lot. Also matters a lot. So source of carbohydrate in the sense, carbohydrate. So maida also is carbohydrate. Wheat flour is also carbohydrate. Dalia is also carbohydrate. Fruit is also carbohydrate. So from where, which should be the source of your carbohydrate to finish your daily requirement of 55 to 60%? That is very important. Then your protein. So protein is one of the macronutrient, and the requirement of protein in our balanced diet, in our daily routine, should be around 1 gram per kg body weight. That should be the normal consumption of your protein. Then the fat requirement is somewhere around 20 to 25% of your daily diet. Your fat should contribute to around 20 to 25%. So how to divide that? What all should be the sources, and how it impacts your uh, total health? So now, when we are talking about women's health, we need to understand that bone health, hormonal balance, then immune function. These are the major factors we are going to focus on, and how deficiency of particular nutrient can affect your bone health, your hormonal balance, and your immune function. So we will speak about that in this in today's session. So very first, let's talk about calcium. So calcium is a major mineral found in your dairy products, leafy vegetables, and many of the packet food nowadays. They are fortifying their food with calcium. So this is the vital nutrient for your bone health. Okay. Other than that, uh, bone health and your teeth, bone, teeth, and it also helps in reducing your, obviously with the bone, it is related osteoporosis and fractures, and for women it is very important for menopausal period. So adequate calcium intake is essential for overall your bone health and bone related disorders, and it is also related to your hormonal balance. Then let's talk about proteins. Now, protein is the what is protein is it is a combination of all essential amino acids. So it contributes in your development and maintenance of your bone mass. Then it helps in collagens. It helps in um, uh, it helps in maintaining your ligament, tendons, and overall bone health and muscular health. So the structure and the strength of bones is also equally dependent on your protein. So the sources of your protein and calcium are pretty common. So dairy products are good in proteins also. Then fish, poultry, they are good in protein. Legumes, dals, nuts, these are uh, good sources of protein. So these also helps in contributing your bone health as well as high in protein. So you need to contribute, where I'm saying 1 gram of protein per kg body weight, you need to understand where to add what all nutrient is very important. Then we'll talk about hormonal balance. Now, fats and protein again plays a major role in maintaining your hormonal balance. So, how omega 3 and omega 6 fatty acid plays major role in your in women's health, in your hormonal health. So, how it supports. So, basically, it has anti-inflammatory properties. It supports in your hormonal regulation. Okay, these are they also play major role in synthesis of your hormones. So preparation of your hormone, synthesis of your hormone is a major part where fat plays a major role. What all are the sources of omega 3 and omega 6 fatty acids? So fatty fish, flax seeds, walnuts, these all are important source for your omega 3 and omega 6 fatty acids. Okay. Um, then another part is about protein again. So as I mentioned, the sources of protein, protein is also a building block for your hormones. Okay, so consuming adequate amount of protein also helps in production of hormone, as the requirement of hormone or the building block of hormone is your amino acids. So that is how fats and protein plays a major role in your hormonal balance. Then we'll talk about immunofunction. So all these bone health, hormonal balance, and immune function, protein plays a major role. Now, how protein plays a major role in your immune function? Very first is production of antibodies, enzymes to your immune system. The cells are produced with that. Amino acids, amino acid is a protein, so it plays a major role in recognizing and fighting the pathogens. So ultimately, in immune function, protein plays a major role. So requirement, as I mentioned, 1 gram per kg body weight is a major requirement for your all these three important factors, important function of your body. Then in immune function, vitamins and minerals plays a major role. Vitamin C, vitamin D, zinc, iron, they they are major nutrients for or building blocks for your immune system. Sources of this vitamin C are all your fruits. They are good source of vitamin C. Indian gooseberries, so amla is one of the major source for vitamin C. Lime, again, these can be available easily in our Indian market. So the usage of these kind of nutrients should be there in your daily diet. Okay. Um, Deficiency of vitamin D can also affect your bone health. So this is all interdependent. So understanding that, of course, vitamin D, nowadays even food you get fortified with vitamin D, but then you need to understand that good source of fat which helps in absorption of this fat soluble vitamins, vitamin A, D, E, K. These are all fat soluble vitamins, and all other vitamins are water soluble vitamins. So the other vitamin requirement should meet in your daily diet, which will be helpful if you consume balanced diet. And vitamin A, D, E, K, these are fat soluble vitamins, so they need the fat source for better absorption in your body. You need to understand this. Then now we'll talk about the portion size of your food. When we are saying that we need to have a balanced diet, how you will divide the carbohydrate, protein, fats, vitamins, and minerals in your diet. Again, this is a personalized nutrition part. So you need to talk to your healthcare professional or any of the dietitian about this. But the portion size, you need to understand yourself first. You need to understand how your how are your hunger pangs, and when you feel hungry, when you get satiety, or you feel full or satisfied. So these are the major factors you need to understand. Now once you start eating, start with a small plate, start with a small katori. The portion, you need to control the portion. The size of your palm should be the size of it should be the size of your chapati or fulka or poi. Okay. Try to consume everything in katori, like your dal, your sabzi, salad. There should be a good big bowl of salad in your lunch, and try to consume soup in your dinner. That will be helpful for good hydration, as well as micronutrients, for good micronutrient absorption. So try to plan your meal accordingly, and think about how you can eat, what kind of plate should be there, how you should serve yourself. Try to serve little at once, or at least half katori. Then don't immediately serve two fulka. If you are used to putting two fulka at one time, try to serve one fulka. Then think about that, how you're feeling. Are you more hungry? Then try to half chapati. In that way, you need to think about yourself. Focus on yourself, and your food is very important when we talk about portion size. Portion can be controlled, but you need to understand that yes, if I'm full, you need to stop there itself. Again, as I mentioned, that soup, something you should add in your diet. Buttermilk you should add in your diet. This everything is going to help you in hydration. Now hydration plays a major role in your digestion, in your circulatory system, and maintaining the body temperature, regulating your body temperature. So your water intake, at least 1 glass of water every hour. That is one way you can put alarm and drink water. People who forget to drink water. Secondly, try to monitor or focus on yourself on thirst. If you feel thirsty, try to drink water. Water is the only source which will help to satisfy your thirst needs. No juices or no other drinks are going to satisfy. So try to drink water when you are thirsty. Okay. And we are going to talk, this video can go on, but we are going to talk more about the deficiencies related to if you are not consuming balanced diet, then what all deficiencies can happen, and what are the causes, symptoms, and side effects of all these deficiencies, and how you should address those, and how you should understand basically that yes, we have this deficiency, because there are very small symptoms where you will understand by yourself that okay, I have these kind of deficiency, and I need to address it, and how to address it. So we will talk about all these deficiencies in our next video, and stay tuned to know more about women's health, and try to make changes in your daily routine. Try to incorporate balanced diet in your daily lifestyle. Thank you so much. Bye bye.